Used to fight cancer. Cytotoxic chemotherapy works by killing rapidly growing cells. This is the cytotoxic chemotherapy. So cancer cells and other ones too. Body cells can also be affected. The skin, the hair, intestinal gastric mucosa, hematopoietic cells. Common side effects of chemotherapy include nausea, vomiting, diarrhea, myelosuppression, alopecia, and many of these chemotherapy drugs are vesicants. So extravasation is an issue and a concern. Cancer chemotherapy can be provided as a sole therapy, the main therapy, or it can also be provided as an adjuvant. So adjuvants are administered after initial treatment, often to suppress secondary tumor formation. And then there are neoadjuvants administered before chemotherapy. Anticancer drugs can be non-specific to the cell cycle or specific to the cell cycle. Alkylating agents are mustard gas derivatives. They are nitrosoureas. They alkylate. They're alkylating like drugs, so they go in and they stick this little cement alkyl group into the DNA, rendering the DNA unstable and unuseful. Cytoxan is one of these meds. It's an alkylating agent. It's a nitrogen mustard. Drink plenty of water to reduce the risk of bladder erosion. So this is an extra add-on to the common side effects. We still have the nausea, vomiting, diarrhea, the alopecia, and the myelosuppression. We still have the risk of extravasation, but this one is an add-on. Drink plenty of water because that bladder can be eroded. Plant alkaloids are much like the other alkaloids. Antimetabolites disrupt cellular metabolism. They have effects of anorexia, nausea, vomiting, diarrhea, stomatitis, alopecia, photosensitivity, increased skin pigmentation, rash, and erythema. So they've got all these kind of skin issues that go right along with it. An example of this is fluorouracil. Antimetabolites can kill cells going through the S phase of the cell cycle. So methotrexate is an example of that. And it is cell cycle specific. Methotrexate, an antimetabolite, can cause pancytopenia, so low everything in the blood, low platelets, low hemoglobin, low white count, everything. So used with salicylates, NSAIDs, sulfonamides, penicillins, and tetracyclines can cause methotrexate toxicity. So when you take those, you can increase the blood levels of that methotrexate. Don't use methotrexate with proton pump inhibitors and or folic acid. Anti-tumor antibiotics. Lots of mycins and rubicins kill cancer cells by inhibiting mitosis and preventing cell division, just like they do to the bacteria. Liposomal chemotherapy, these little neat little packaged little medications that can package up in liposomes within the cell, things like doxorubicin, daunorubicin, and cytarabine. Anti-cancer hormones can be used. Just know when the anti-cancer hormone is used, we can reduce the risk of some cancers. So if we reduce the risk of breast cancer, sometimes we'll increase the risk of other cancers, like maybe uterine or things like that. So there are other targeted therapies. So they get even more specific than traditional cancer therapies. And they sometimes target very specific proteins on the cell or on the membrane or inside the cell. They target different things like the tyrosine kinase inhibitors that inhibit specific kinases within the cancer cells and the vessels surrounding them. Epidermal growth factors, which inhibit some of those things. but also focused on the epidermis. Vascular endothelial growth factors that work on decreasing that vascularization. That vascularization is called angiogenesis. There's angiogenesis inhibitors that inhibit the blood supply to the tumor. And then there are things like biological response modifiers, in which monoclonal antibodies are a part. These ones are really weird because they incite the body's own immune system to attack and to attack those cancer cells. So they really are revving up the body's own immune system. Other biological response modifiers besides monoclonal antibodies can include interferons, interleukins, and colony-stimulating factors.